Okay, folks, welcome. I'm Neil Cohen. I'm the director of IHSI, the Interdisciplinary Health Sciences Institute, and I am really happy to welcome you all. The recent health crises faced by our community, our nation, and the world have challenged our university, and more particularly our health sciences ecosystem, to act more intentionally and ambitiously and translationally than ever before. IHSI has been revisioning itself, organizing itself around a set of cores that provide services and resources to faculty and units across campus in order to support the continued growth of the health sciences campus-wide. Today, the amazing professionals at IHSI who are developing and supporting these capabilities are here to tell you about each of the cores and how you can avail yourselves of their services. So I'm pleased to hand you off now to Maggie Berg, who will walk you through the agenda and tell you what you can expect over the next hour. I want to thank you all for tuning in. I'm sure you will enjoy hearing what is percolating at IHSI and what opportunities they afford you. Maggie, it's all yours.
Thanks, Neil, for bringing us all together today. Welcome, everyone. Thank you all for being here. My name is Maggie Berg. I'm one of the research development managers at IHSI. So before we get into everything, we just want to start with a quick poll to find out how you all heard about this event today. So I believe Amy is going to load that. I'll just take a couple minutes to fill that out. So while we're doing that, I just wanted to say that we are all excited to introduce our 6 new cores. We have representatives from each core here. We've all recorded a short presentation to share what we do and how you can partner with us. All the presenters will also be participating in a live panel discussion Q&A session after the presentations to answer your questions and give more details about what our cores do. After we wrap things up, you're welcome to stay on afterwards to chat with us in breakout rooms. If you have more specific questions or something we didn't get to, or just want to get to know us better, you can just chat with us there. So as we play the presentations, you are welcome to drop your questions into the chat, or you can private message one of us. Amy Claymore is happy to accept your questions, and those would be anonymous. And then we will get to those questions after all the presentations are over during our Q&A. So we're going to get started with the Research Development Core, which is the core that I lead. And so you'll be hearing from me. My name is Maggie Berg. I'm a Research Development Manager, and I'll be talking about the Research Development Core at IHSI, who we are, what we do, and how you can work with us. But first, I want to talk a little about the research lifecycle as we see it. This cycle doesn't necessarily have a start or end point, and you can skip around to different steps in the process. I'll be coming back to this figure later to show how the Research Development Core can support what you as researchers are doing at various points in this cycle. The goal of the Research Development Core, or RD Core, is to expand the health sciences research portfolio for the UIUC campus. This is our team. We all have advanced degrees in a variety of scientific disciplines and have a lot of expertise to offer. The RD Core aims to expand health sciences research on our campus by providing support in 2 ways, through faculty development and training and through proposal development support. These are our faculty development and training programs. The NIH Grant Writing Series and DoD Grant Seeking Workshop both provide an overview of the entire grant writing process, from finding funding opportunities all the way through submission and review of the proposal for the respective funding agency. We're also launching peer accountability writing groups this summer around a specific funding call, and we hope to offer more of these in the future around various funding mechanisms. You can learn more about these programs on our website, or you can contact me directly. The second way we're expanding health sciences research at Illinois is through proposal development support. So our role in proposal development is to ease some of the administrative burden on the PIs to allow them to focus on the science. We identify campus strengths and priorities and match those strengths to the sponsor priority areas. And we also facilitate collaborations. And we've decided to take a team approach to proposal development support. So when you work with us, you'll be in contact with at least 2 members of our team, and the rest of the research development team will be there in the background to provide additional support as needed. These are some more concrete examples of the support we provide. We can facilitate brainstorming sessions. We can help you find funding opportunities or collaborators, both internal or external collaborators. We can help manage the writing process. We can provide letters of support from IHSI, and we can review your documents for alignment with the funding opportunity announcement and sponsor mission. So if you'd like to work with us, our goal is to actually have a partnership with you, the researchers. We want to be thought of as part of the team, and it helps if you bring us in early, ideally during strategic planning, so that we can be most effective. So if you'd like to work with us, you would first reach out to one of our RD team members. They'll set up an initial meeting with you to learn a little more about the project and how you would like us to be involved with it. They'll also send you an intake form. And once you have that completed, the rest of the team will review the request and we'll consult with IHSI leadership as needed to decide if we can take the project on. So these are the criteria we consider when deciding which projects to work on. So first, the project must be health related. We do have a preference for large multi-PI, multidisciplinary projects, but we will work on smaller proposals like R21s or R01s to support early and mid-career PIs as well. We will also take into consideration campus priorities if we have to choose between a couple of larger projects. So coming back to that research lifecycle diagram, this is how the research development core fits in with what you're doing in this research lifecycle. So we have our faculty development and training programs in orange and our proposal development support in blue. So during strategic planning, we do keep track of funding priorities and trends and can facilitate brainstorming sessions and kind of gauge whether your project is a good fit for a certain agency. Our grant seeking training programs also touch on strategic planning a bit. We can help you build your research team by finding collaborators. We can help you find funding opportunities and identify resources. Our grant seeking training programs also give advice for finding funding. During proposal development, we can help manage the writing process. We can develop some of those common proposal elements and review draft proposals. We can also facilitate peer accountability writing groups to help you keep on track during the writing process. So if you'd like to work with us, you can learn more on our website or you can reach out to me by email. Thank you. And we'll be moving on to our next core, which is community academic partnerships. Let's take that away.
The Community Academic Partnerships Core creates and supports community academic collaborations to improve public health. Today, we will share how the core supports faculty, students, and community collaborators. My name is Emily Stone, and I am a Research Development Manager in the College of Education and IHSI. I am also a Public Engagement Fellow in the Office of the Chancellor.
And my name is Kelsey Hassevort. I am a Research Development Specialist at IHSI.
We see the mission of the CAP Core as creating and supporting community academic collaborations to improve public health. Specifically, the core builds partnerships to support students, faculty, and community collaborators. In the following slides, we will walk through the ways in which the core will support each of these stakeholder groups.
This figure illustrates the ways in which IHSI's CAP Core can offer support for health researchers across the research lifecycle. We have the capability to offer support at every stage, from identifying relevant funding opportunities to bringing together teams of academic and community collaborators to pursue funding, coordinating proposal development, and providing infrastructure for research dissemination. Throughout the research lifecycle, the CAP Core can support researchers through targeted workshops and training.
We see the core as supporting faculty in 3 key areas: proposal development, community partner connections, and training and community engaged research. The CAP Core proposal development is consistent with the support that you heard about from Maggie Berg and the Research Development Core. I will share more details about the community partner connections and training in the following slides. Yes, we will matchmake, but more importantly, we will stay involved to continue to support these partnerships as they develop. As Kelsey and I have already seen in our work, making connections can be straightforward. Once connections are made, the Community Academic Partnerships Core will support these multi-stakeholder teams by helping with setting clear expectations, navigating power dynamics, and building mutual trust and respect. We are exploring a variety of different training options for faculty in community engaged research. This can include methods in community-based participatory research, focus groups, and interviews.
Beyond the direct support that the CAP Core can offer to faculty, we also serve researchers and their students through a number of programs that we lead. At present, these include We See You, a community engaged service program for undergraduate and graduate students, the Community Academic Scholars Initiative, a community engaged research experience for undergraduates, and the Community Seminar Series, a research dissemination program for graduate students in partnership with Illinois Extension. We See You is a community engagement program for students campus-wide that launched in June of 2020. We See You honors students for their community-based work and provides them with training access to service opportunities and partner organizations. We See You matches community-based projects with service learning classes, student groups, and individual students. If you are an instructor and would like assistance with finding service projects or connecting with community partners, our We See You team can help. The Community Academic Scholars Program is a 10-week summer program in which students conduct research in collaboration with a faculty mentor and community partner. If you are interested in receiving the support of a community academic scholar for your community engaged research project, consider applying to the program for next summer. The Community Seminar Series offers graduate students an opportunity to develop their science communication skills and disseminate evidence-based information to the broader community through webinars. Graduate trainees are mentored by Illinois Extension educators and are part of a collaborative cohort that provides peer-to-peer support. If you're a graduate student or postdoc or a faculty member whose trainees are interested in science communication and outreach, consider meeting with the CSS program team to learn more. In the words of our chancellor, yes, we imagine solutions to global challenges here at Illinois, but the results of our work will always be measured in the impact on individual lives. This is exactly the kind of impact we know the Community Academic Partnerships Core can have. To reach our team, please feel free to email myself or Emily. We look forward to working with you.
Thank you, Kelsey and Emily. We'll be next moving on to health equity.
Hello, my name is Brandy Barnes. I'm a Research Development Manager, and today I'm going to be talking about our Health Equity Core. First, what is health equity? Health equity means that everyone has a fair and just opportunity to be as healthy as possible. So if a health outcome is seen to a greater or lesser extent between populations, then there exists a disparity. And we're not just looking at populations across racial or ethnic lines, but also across gender, sexual identity, age, accessibility, socioeconomic status, and geographic location. There are many ways that the Health Equity Core can help faculty throughout the research lifecycle. We track research trends and institutional priorities in health equity. We're able to identify potential campus and community collaborators while making sure that the funding opportunities we send to faculty are tailored to their individual research needs. We work closely with the IHSI Research Development Core throughout the proposal development stage, often acting as a liaison with institutional and federal entities on behalf of the research team. And finally, we assist in research dissemination campaigns to stakeholders and the community. We've worked with almost a dozen different units on campus in fields that you might not expect that would use a health equity lens in their research. Fields such as urban and regional planning and civil and environmental engineering. In addition to our faculty support services, we also work with students combined with our Community Academic Partnership Core on our Scholars Initiative. We have had 10 Scholars for Health Equity that have looked at community engaged research projects that range from topics including aging, nutrition, mental health, food security, as well as social and emotional learning in school-aged children. We are working to build a health equity community. We do this through collaborations across campus to bring in health equity speakers. We often co-sponsor events and conduct workshops for university and community researchers. Right now, we're looking to add additional services to the Health Equity Core. We have deployed a survey to some health equity researchers on campus. We've received those results. We are in the process of conducting follow-up interviews, and based on those needs, we will develop a plan for future resources. If you have any questions or any services that you would like to see with the core, please feel free to contact us at the information below. Thank you.
All right, thank you, Brandy. Next up is going to be our Clinical Partnerships Core, which also includes the Mayo Clinic and Illinois Alliance.
My name is Deborah Miller, Assistant Director of Clinical Partnerships and Mayo Clinic and Illinois Alliance Program Manager. I'm here to talk about the Clinical Partnerships Core at IHSI. This core seeks to establish robust partnerships between you and various healthcare entities. We connect your research areas with real-world issues to discover solutions and create impact. We forge clinical partnerships built on trust and expertise that help to build the biomedical workforce of the future, increase the research portfolio at Illinois, and affect patient care. Our clinical partners team is here to foster and manage all aspects of the relationship, including matchmaking, resource identification, project agreements, and celebrating the results of the partnerships. The Clinical Partners Core can be critical in every area of the research lifecycle, from project development through implementation. Our primary focus is to establish collaborations that expand your research team to include physicians, research and clinical scientists, and students. Matchmaking is on a case-by-case basis. Potential partners include health entities like Mayo Clinic, Carle, OSF Healthcare, Carle Illinois College of Medicine, and other Illinois units like the Cancer Center at Illinois, Granger College of Engineering, the National Center for Supercomputing Applications, the Illinois Neurobehavioral Assessment Lab, the Center for Social and Behavioral Science, Siebel Center for Design, and the Illinois Multiple Sclerosis Research Collaborative. And we are seeking to further grow these relationships and many others. A long-standing and successful clinical partnership to date is the Mayo Clinic and Illinois Alliance for Technology-Based Healthcare, a highly interactive and robust collaboration that started in 2010. Researchers from both institutions have collaborated on over 100 projects, research articles, patent disclosures, and tools and algorithms that are being used in clinical practice today. In addition, through our educational programs, the Alliance has prepared over 100 trainees for careers in biomedical research. Collaborations are driven by our trusted relationship as we identify a specific area of research or a translational need. The Clinical Partners Core is involved in numerous education and training opportunities to assist Illinois researchers and their students and to demonstrate Illinois' strengths to our partners. As an example, the Computational Genomics course is in its 8th year and highly valued by clinicians. We are seeking to develop further courses. We have hosted workshops on various topics, including broad areas like AI and COVID-19, and are considering a speaker series for students and researchers. 7 Illinois undergraduates are pre-selected as summer undergraduate research fellows at Mayo. We are also growing our 2-year Mayo Clinic and Illinois Alliance Fellowship for Technology-Based Healthcare program, where we match clinicians and Illinois principal investigators with some of our brightest doctoral students. Other programs include the Psychiatry Residency Research Program with Carl. Research is focused on technology-based solutions for various diseases and clinical issues and leads to numerous research projects, grant proposals, and even films. The Mayo Clinic Heritage Film Series recently spotlighted the collaborations of Professor Bruce Folk in kidney stone research. The Clinical Partner Corps helps to support the research lifecycle by matching needs from Illinois researchers and clinical partners to identify any potential specific education and research opportunity. Describe to us your project in need. We will intake your information and assess opportunities. We will then seek to build the team with a particular department or unit of individual researchers, scientists, and students. We will determine if there are resources to support the education and research work. Are there departmental funds that can be used to do this collaboration before applying for external funding? Is there already an identified funding opportunity? We would work to develop project agreements with specific outcomes, deliverables, and goals. We would ensure continuous project communication between researchers, clinical partnerships, and core leadership to evaluate progress and determine next steps. We would love to talk with you if you think that your research could benefit from a clinical partner. Contact us and we'll explore together. Thank you.
All right, thank you, Deborah. We have 2 more cores to go. So next up is going to be the Biostatistics, Epidemiology, and Research Design core, also known as BIRD.
Hello, everyone. I'm Aman Kaur, and I work as a research biostatistician at IHSI's Illinois Biostatistics, Epidemiology, and Research Design core. I'm here to talk about how BIRD core can be of assistance to you while you plan your research project or implement your research study. In the life cycle of a research project, BIRD can assist you at multiple stages. Ideally, BIRD can be invited to collaborate on projects while the PIs are building the research team. It's a model situation for us as we get to know the research team, their expertise, and the research itself a little better right from the beginning. Generally, we are invited at the proposal development stage, and at this stage, BIRD can provide statistical guidance on study design, conduct power analysis, or write a statistical analysis plan for your grant application. BIRD can also support you in addressing reviewers' comments while your grant application is being reviewed. And once your study is funded and the research is being implemented, BIRD can provide a multitude of statistical services such as guidance on data collection and data management, conducting statistical analysis, interpreting results, and manuscript development. You may seek BIRD assistance at any of these stages. In addition to the services I already mentioned, here's a list of some more services, which include design of data collection instruments such as surveys and their validation, assistance with abstracts, manuscripts, and poster development, data specifications and preparation of data sets, meta-analysis, and program evaluation. In terms of expertise in statistical methods, we employ epidemiologic methods in observational and experimental studies. We often work with longitudinal and cross-sectional data analysis. We are adept in generalized linear and generalized linear mixed models, multi-level models, and dimension reduction techniques. In addition to these, here's a list of some more methods that we have expertise in. In terms of software, SAS is the primary software that we use to conduct analysis, and PASS is used for sample size calculations. We can also work with SPSS data and R. Now that you know about our services and expertise, how do you work with BIRD? I encourage you to review the details on the IHSI website about our team, services, and our policies. You may initiate a project with us by completing a project initiation form in which you would be asked your contact details and a little bit detail about your research. You would be invited to attend an initial consultation meeting in which your statistical needs would be assessed. You may further be asked to sign certain required agreements, and this varies from project to project. And in the end, you may decide to collaborate with BIRD for your research project. It's also essential here that I talk about how do we prioritize projects since we do get multiple requests. The first priority would always be given to the new health sciences grant applications for federal agencies such as NIH and NSF, etc. The second priority would be to analyze the existing data for the funded projects. And lastly, we would work with the non-funded projects for data analysis, for manuscripts, abstracts, or for other internal purposes. When you decide to work with BIRD, what can you expect? At expert level, you may expect PhD level work in advanced biostatistical and epidemiologic methods. Jesus Sarol works at an expert level, and he has a background in epidemiology and biostatistics. At intermediate level, you may expect master's level work in advanced biostatistical and epidemiologic methods along with data management and programming. I myself work at an intermediate level, and I have a background in dentistry, epidemiology, and biostatistics. At basic level, you may expect master's level work in commonly used statistical methods along with data management and programming. Fatima Ahmed works at a basic level, and she has a background in nutrition and biostatistics. As you can see that our team is very diverse when it comes to our backgrounds, and this has been our strength in working with researchers across campus. I will also highlight here that all pre-grad work is provided at no cost to the internal clients. And feel free to check our rates on the websites for each expertise level. You may know more about us at this website, or you may directly contact us at the given email. Thank you so much.
Great, thanks, Amin. Our last core, excuse me, is the REDCap core. I should say last and certainly not least is the REDCap core. We'll take it away, Heather.
Hello, my name is Heather Bernardo, and I am one of the REDCap application specialists at IHSI. I'm here to talk about how the REDCap core can fit into the research lifecycle. What is REDCap? REDCap stands for Research Electronic Data Capture. It is a secure web application for data collection and database building. It is capable of compliance with the Health Insurance Portability and Accountability Act, HIPAA, which is a federal medical privacy law, and the General Data Protection Regulation, GDPR, which is a European privacy regulation. Some of the capabilities in REDCap include building forms, surveys, and reports, creating email alerts, notifications, and automated survey invitations, and customizing user rights and roles to control access to data. While planning your project, the Illinois REDCap team is here to help you determine if REDCap fits your project needs and expectations. If your team moves forward with using REDCap, our team will direct you to the resources needed to obtain REDCap access and training, as well as share any additional resources that may be helpful while you seek funding opportunities, develop proposals, or other documents needed for your project. Finally, we can build or provide support while you build the project tools necessary for data collection in REDCap. REDCap is ideal for small to medium-sized projects, especially those involving high-risk data. It is best suited to quantitative data collection and has features that allow for cross-sectional or longitudinal study designs, as well as multi-arm studies or studies in which participants are randomized. As mentioned earlier, REDCap also allows project managers to control who has access to different parts of data within the project, making it a helpful tool for multi-institutional studies. Any data collection is possible. Projects can range from being research-related to being administrative-related, such as project management and organizational tools. So you've determined that REDCap is an option for your project. What now? The Illinois REDCap team can help you and your team members obtain REDCap access. This may involve directing external collaborators to where they may obtain Illinois credentials, as well as directing potential REDCap users to the U of I system HIPAA training. If you're interested in getting an Illinois REDCap account, you can access a user request form in the link pictured here and posted in the chat. If needed, we can also provide additional REDCap related resources that may be helpful as you develop your project. This may include resources about e-consent verification, system security, and HIPAA and GDPR compliancy. Finally, we can build or assist in building the project in REDCap so that your team may begin collecting data. Not only do we provide ongoing support in REDCap, but we also offer project build services in which we work with your team to build and test your project in REDCap. We can build and test a REDCap project or its parts according to your specifications. This may include setting up e-consent, building surveys, formatting automated survey invitations, creating user roles, and developing training materials for your team members who will be using the REDCap project. We will also work with you to align which REDCap features will best fit the needs of your project. Once built, it's up to your team to manage the project, but we will always be available for ongoing support. To set up an initial consultation, you can email the Illinois REDCap team. Our email will be posted at the end of the presentation. And of course, the Illinois REDCap team is here to assist you in all of your REDCap needs throughout the data collection process. We offer beginner and advanced workshops each semester. We have weekly office hours, and you can always email us questions. So please check out the IHSI website for additional REDCap support documents, checklists, and how-tos. Thank you.
All right, thanks everyone. I believe Amy is going to take over to moderate our Q&A.
Hi, everyone. I'm Amy Claymore, Communications Coordinator for IHSI. I hope you enjoyed learning a little bit about each of our core teams today. And I will open a poll momentarily for you to indicate your interest in any of our cores. And then we'll have a member of the cores reach out to you in the coming week to connect with you and answer any questions you may have. So now we will take some time to answer your questions. Got a lot of great questions in the chat that I will go ahead and start with. You are welcome to continue to post questions in the chat and or raise your hand, use the raise hand function, and I'll call on you and unmute you as we get through the questions. But let's get started because we have many, many. All right, the first question I received is for the Health Equity Core for Brandy. Would it be possible to still provide feedback to the core on the new services? Can someone who has not sent the survey previously still complete it?
Yes, so that is a great question. We are still accepting feedback on the survey. We actually recently reopened it, and I think we can place that in the chat, and it is there now. So feel free to complete the survey if you have any questions, or also if you're interested in doing one of the follow-up interviews with me, please also reach out. So yeah, thank you for that question.
Great. And then another question I received was, could you clarify what is meant by core? For example, if I have a project that connects with multiple cores, how do I decide which core to contact? Do researchers predominantly work with one core and their resources are potentially multiple cores?
I'll take this one. The cores actually come from the NIH Clinical and Translational Science Institutes. We're kind of trying to build IHSI around that CTSI-like core structure to provide identifiable, reliable services and resources that can support health research on campus. in terms of which core to work with, or if you're only going to work with one at a time, I hope that you kind of saw during the presentations that a lot of our cores have a ton of overlap. We actually work very synergistically with each other. The whole IHSI team is very much a team. And so if you contact one of us and maybe it's not quite the right fit, or if you end up maybe needing to work with another core, we'll definitely put you in touch with the right people. So it really just depends on what you're doing, whether or not you'll work with one core or you'll work with multiple.
Thank you, Maggie. Does IHSI or its cores interface with the other U of I campuses in Springfield and Chicago for cross-campus health initiatives? These are kind of general questions not directed at a single core. So up and up for grabs.
Is Neil still on?
I believe he is.
Neil is, and so it's a really good question and an interesting question. We have there are both institutional relationships and individual relationships. So certainly there are lots of person-to-person, peer-to-peer relationships between faculty researchers here and those particularly at the, say, the med school at UIC, and we can help in that regard. The particular entities you heard about earlier, Mayo as part of the Alliance, OSF, or Carl, in addition, have more institutionalized relationships and people who tend to the relationship at the organizational level. In the role that the folks you see before you currently play of convening groups, of finding good colleagues to work together, of course, we're happy to go across campuses. And there are examples of that we could direct you to.
Thank you, Neil. Our next question is, for departments offering grant administration services to their researchers, how will they fit into the IHSI model? Is it up to the researcher to make these connections? SPA?
I think, I guess this is probably a question for me. So with our proposal development support, we are different from what you might have as a grant administrator in a department. So for instance, many of us have PhDs in sciences. I personally have a PhD in microbiology. So I'm not necessarily an expert on budgeting or that kind of thing. So that would be something that your department would hopefully take care of, and we would be more than happy to help connect with them and work with them as well. So we would be more on the side of, really assessing whether that proposal is fitting with the sponsor and what the funding opportunity is laying out. We would help with the writing process, so managing your team, building your team, and that sort of thing. So it's not necessarily the same as what your grants and contracts people are going to be doing, but we would certainly interface with them.
Thank you, Maggie. I should have combined this. There was a question between the two. So another person asked, along the same lines as Steve's question, how does IHSI partner specifically with College of ACES to embed sustainability and systems design into project and community health outcomes?
That's a great question. I think that probably hits at the intersection of the CAP core and Brandy's work with the health equity core. We do work, it kind of depends on the specific nature of the partnership that we're supporting, but we certainly do work with our colleagues in the College of ACES. We are also part of a campus-wide outreach and engagement professionals network, which is made up of a lot of staff members like myself and Emily, who do engagement and outreach work, and that certainly includes colleagues in the College of ACES as well. So we're very open to it, and we work with them, kind of on an as needed basis, depending on the type of project that we're supporting.
If I could add just one more thing to that, So individual units, including particular departments and particular colleges, of course, have the wherewithal to go after particular domains of knowledge, particular domains of funding. We, as one of the institutes, like the other institutes, try to live in a space where the challenge is greater than that or more interdisciplinary than that, requires the convening of people across departments, across units. So we're particularly involved, or find the sweet spot for us is those places that really require building bridges across units. And never would we compete with individual colleges in individual departments, et cetera. By the way, we don't get any ICR. So there's truly no competition with the units, in case you're wondering. So our goal is to bring people together, bring units together to go after, to help enlarge the research portfolio, help to create opportunities here, to build out the health sciences ecosystem, and to make it as seamless and campus-wide as possible. So we welcome opportunities to partner with particular colleges. We don't limit ourselves to any individual college, including, by the way, the Carle Illinois College of Medicine would be one of the colleges, Granger College of Engineering, LAS, ACES, IHSI, are all, each of those are colleges with whom we work and play and whose mission we're interested in helping to advance.
Great, thank you, Neil and Kelsey. Finally, I have, where does environmental health research and outreach fit into your program? Things like water quality, private wells, drinking water, groundwater contamination.
I think that could fit into a lot of different places. It kind of depends on what you're wanting to do. If it's something like trying to build a new project or submit a proposal, develop a proposal, then any number of us would be there to help you. In terms of outreach, that might be more of our community academic partnerships or health equity, depending.
Yeah, Maggie, I just wanted to jump in and say I've actually worked with a couple of groups on issues around this. So typically they involve a community organization and looking at health equity, or looking at equity in terms of air quality, pollution. So like Maggie said, there's a bunch of different ways that we can help you in this area in terms of IHSI. So please definitely reach out.
If I could add one more thing on that as well. So another natural home, or another home that overlaps with some of the things Steve's asking about, is IC, a different institute. And we have begun conversations about how IC and IHSI can collaborate on some of those areas. So Steve, maybe you can help push that collaboration to grow, to build out as well.
Great, thank you all. Okay, the next question is for the Bird Corps, unless I missed anything else in the general chat. How does one bird member work with a single, or I'm sorry, does one bird member work with a single client or collaborator, or the whole bird team? How does this work in terms of billing the clients? Aman or
Thank you, Amy, for that question. I will take that. Can you hear me, Amy? My Wi-Fi is pretty unstable. Okay. It varies from project to project. Generally, we work as a team. If not all three of us, then at least 2 expertise levels would be involved in a certain project. And in terms of billing, we are very mindful that based on the expertise level, we will bill the client accordingly. If there is some basic or intermediate task that I know that I could do, then I would not go to doctor's role to do that analysis. Then I can handle it and it would be billed at my level. So we are mindful in that, in billing the clients accordingly.
Thank you, Aman. Okay, can you describe the CAP Corps' process for working with faculty members who'd like assistance with building community engagement into their work?
That's a great question. Thanks, Amy. So the first step would be to have a consultation meeting with either myself or Emily or both of us to learn a bit more about the faculty members' needs and the ways in which they'd like to incorporate community engagement into their work. So for example, if it's a faculty member who's teaching a course and they'd like to build in a service learning component, we have the WeCU program team that we would most likely direct them to, who can really assist them in getting that built in without too much extra work on the part of the faculty member. If it's a community engaged research question, that's something that we might bring to the research development team if there's a funding opportunity involved, or we could help matchmake with a community partner and pair students with opportunities as well. So the first step would be to reach out and meet with us, and we can take it from there.
Thank you, Kelsey. Okay, for clinical partnerships, are you able to match all researchers with clinical partners?
Thanks for that question. It just depends on the needs of both the clinical partner and the researcher. So again, like you've heard from many of my colleagues, it would involve a sit down to really understand your full needs, what resources you have, and what you're really seeking. Are you seeking, are you ready to apply for a grant and you just need the clinical partners to finish the project? Are you at the beginning initial level where you want to start a project? We, as I said in the presentation, really try to make it a truly collaborative and trusted partnership where you're seeking the same goals and outcomes. So again, it's about intake. It's about finding a clinical partner that is interested in that same research and determining the outcome that both the clinical partner and our researchers want.
Thank you, Deborah. For REDCap, what sets REDCap apart from other survey tools such as Qualtrics?
So with Qualtrics and REDCap, they have very similar features. One of the things that sets it apart on campus is that REDCap is HIPAA capable and GDPR capable, as well as there's just some other features that with like logging and project history that you can go back to and look for like auditing purposes. Michelle, if you want to jump in for any other specific features that you think of.
Sure. So my name is Michelle Orr. I'm the other REDCap application specialist at IHSI. In addition to what Heather mentioned, I think Qualtrics and REDCap are both really great tools. Obviously, we're a little bit biased towards REDCap, but I think knowing what each of them does and knowing what is essential for you to collect the data you need to the best of your project's ability. And so sometimes that might be REDCap. I think another thing that is a great advantage of REDCap over Qualtrics is its longitudinal capabilities. But there are some things that Qualtrics does a little bit better, specifically with dynamic randomization or randomizing questions and things like that, that REDCap, because it was designed to be a clinical data collection tool for clinical trials, it doesn't have that flexibility. And so if you have any questions about what REDCap can do, we're happy to answer those so you can find the right tool for your project.
Thank you, Heather and Michelle. Okay, the next question I have is, how does the Research Development Corps differ from the Office for Proposal Development?
Thanks, that's a great question. We are very, very similar in terms of proposal development support that we provide. We actually consulted with OPD as we were building our plan for the Corps. And the way that we differentiate ourselves is the projects that we take on are only health related, whereas OPD will work on, I think, just about anything. So they're more open to different disciplines than we are, although health is very broad. the other way that we're a little bit different is that we are willing to work on some of those smaller proposals. I know OPD generally only takes on really large multi-PI proposals. So we are willing to work on some of those smaller projects as well, because we feel it's really important to support a lot of our early and mid-career faculty, in addition to some of our more established faculty.
Maggie, if you don't mind, let me just add one thing. So for IHSI, you should understand that proposal development is just one time point in the overall life cycle that each of the core leaders showed you today. So when you in working with IHSI long before there's a proposal, helps in convening of the right people, expounding on the ideas. You get content experts who will help direct you to potential sources of funding, which in turn can help you craft a proposal with substantive expertise that fits nicely in one or another of the available resources and can work with you throughout. So to add the bird component as part of the grant, to add a clinical partnering or a community academic partnering portion to your grant are all things that are part of the larger set of capabilities that come out of working with IHSI. So proposal development somewhere in the middle of that life cycle, but much broader for us than for most entities.
Yeah, that's a great point. Thank you, Neil. Yeah, I always like to say also, so another thing, we do partner with many units on campus, including the Office of Proposal Development. We have lots of friends over there. I always like to kind of take one of their sayings from OPD is not instead of, but in addition to. So we're not here to compete with anybody. We're happy to work with all units on campus.
Great. Thank you to both Maggie and Neil. The next question I have is for the Bird Corps. How does Bird handle data in terms of de-identified or identifiable data?
I can take this again. To be HIPAA compliant and for protection of the health information, we do urge our clients to share de-identified data with us. But if they have to share the identifiable data for the biostatistician to analyze or review, then we do ask them to amend the IRB and identify the biostatistician in their IRB application. In addition, I would also say that if the data has not already been collected, please use REDCap. It's a great tool.
Yes, thank you, Aman. That's a good plug. We really do work pretty cooperatively over here at IHSI. The next question I have is for the Clinical Partnerships Corps. Can you describe research opportunities for students?
That's a great question. I talked a little bit about it in the presentation, but please, if you have bright students who are looking for detailed opportunities to work with clinical partners, please make sure that they follow IHSI's social media channels and check the website for opportunities. We do have opportunities for undergraduate students, as I mentioned, to work with Mayo Clinic for the summer. So we pre-select 7 because of our trusted partnership with Mayo. And then actually, I think there are 11 Illinois students in the 2021 cohort. So then they are assigned a PI for their summer experience at Mayo. The fellowship program is for doctoral level students. It is a 2-year fellowship. We do match PIs at both Mayo and Illinois. So it's really driven by the PI's research and the students' interest and expertise. And it is a great relationship for the student and the PIs. And 3 of our former fellows now work at Mayo Clinic. So it's been a great partnership. So there are many opportunities. And if you have students or research areas, again, we'd love to talk to you more about how those students could assist.
Great. Thank you, Deborah. Let me see if I've missed anything here. Can you just, oh, this is for you as well, Deborah. Can you describe the process of developing a clinical research partnership?
Yes. First start is always going to be conversation, right? So you can make an appointment with Leanne or I. You can talk about your research and your needs, and then we will begin the process of talking with our clinical partners and see if there is a direct match. If there is a match, it is, a very formal process where we do actually document the agreement and the relationship and the outcome and the deliverables. And we work very closely to make sure that it is a win-win situation for everyone.
Thank you. Okay, looks like we have a REDCap fan in the house. What is your favorite thing about working with REDCap?
I can go first. So my favorite thing about working with REDCap, I will have to say the community. So REDCap, I didn't say this in the presentation, but it was developed by a group of research clinicians at Vanderbilt University. And the creators and founders have really come together and made sure that REDCap administrators and different institutions are able to communicate in the REDCap consortium. So it's like a forum of REDCap administrators. And so like we learn about different, as administrators, we learn about different projects and how REDCap is used in different ways. And I think that translates also to back to the university campus, kind of connecting to the last question about what sets it apart from other survey tools. So with Qualtrics or SurveyMonkey, when you're troubleshooting something with that survey tool, you're calling like a help desk. If you need troubleshooting with REDCap, you're talking to Michelle and I. And so we could really get to know your research team, your project, and it makes it more personable, I think. So that's one of the big things that I like about REDCap.
I'll also add, that's a really great question or answer, Heather. But sometimes working with REDCap is like a really big puzzle, or just working on helping faculty members or grad students with their projects is a big puzzle. And so somebody will come to us and say, we need to collect data in this way. How can we do that? And REDCap is a really powerful tool and can accommodate a lot of different research designs that might not be super obvious. And so so we're able to kind of tinker around and play with it and try to figure out the best solution, as well as like Heather mentioned, where we can go to that community administrator site and say, hey, somebody came to us with this issue. Has anybody done something similar? What has worked for y'all? And then we're able to really put a lot of brain power behind making sure everybody can collect data to the best of their ability.
Thank you. That's all of the questions we have.
Yeah. Thank you, everyone. Thank you especially to our speakers and IHSI staff who worked so hard to put this together, especially to Amy Claymore and the communications team who give us a lot of support. Thank you to everyone who joined us today. I hope this was informative and that you're leaving with a better idea of what we're doing at IHSI. We are also proud to announce that IHSI launched a new website this morning. It's really shiny, pretty new. It's very nice. Our new website better reflects how IHSI is evolving to meet pressing health challenges and better support health researchers campus-wide. So we hope you take a moment to check that out. So this concludes our program. If you would like to continue the conversation with us, you may join us in the breakout rooms. But for those signing off, thank you again for being here, and we hope to work with you soon.